In this video we are going to look at restoring pit and fissure caries in a primary molar, and to illustrate this we are going to look at the 6-4 or the upper left D. You will note that we've placed some purple ink to illustrate where we might normally see a shadow or stained area that would indicate this caries. It may have been picked up on radiographs also. To prepare the cavity we are going to need a very small diamond burr in the high speed, such as a pear-shaped or round diamond, and we will also need some steel burrs in the slow speed, and these would usually need to be very small, such as around 1/2, 1 or 2. Firstly we are going to access the caries using the high speed. Normally you would use the drill perpendicular to the occlusal plane of the tooth, but I am going to angle it here so that you can see what I'm doing. The depth that we need to go to is about 1 to 1.5 millimeters, which will be just beyond the depth of the head of the burr in this case. This will take us to the ADJ where the caries is likely to have spread. Once we have accessed the caries we can use the slow speed handpiece in order to remove any caries that remains on the walls and base of the fissure. Remember that primary teeth have very high pulp horns and very thin enamel and dentine layers in comparison with permanent teeth, and so we should be careful not to go too deep. Once the cavity has been prepared and the caries removed, it's important to check that the outline form and the base are all smooth. This is best done with a small sharp probe. We are going to restore the tooth with compomer, in this case Diract, and so the first stage is to etch the tooth. The etch is introduced on a micro brush, and it is important to ensure that the etch reaches the base of the cavity. The etch is left on for the manufacturer's recommended time, and then washed off with water from the 3-in-1 and dried with air from the 3-in-1, both for the manufacturer's recommended times. The next stage will be to apply some bond, again using a micro brush, and again it is important to ensure this reaches the base of the cavity. Once applied, this can be thinned with air from the 3-in-1. This will also help to ensure an even distribution of bond. The bond is then finally light cured for the manufacturer's recommended time. The next step will be to introduce the compomer into the cavity, and this can be done either directly from the compule or on the end of an instrument. Here we are going to apply directly from the compule, and it will be important to ensure that this stays within the cavity. This can then be packed into the cavity using a very small plugger. Sometimes placing a small amount of bond on the end of the plugger will help separate it from the compomer as packing takes place. The margins of the restoration can then be adapted to the rest of the tooth using a variety of instruments, in this case a burnisher. Once we are happy with the shape of the restoration, this is then cured from the manufacturer's recommended time. It is then a good idea to polish the restoration, and the best way of accessing the pit and fissure areas is with a rugby ball shaped microfine diamond. Sometimes excess bond will remain on the unprepared enamel and this can flake off. This is not an issue, but to save the patient having bits in their mouth, it can be useful to remove this with an excavator or similar. Following this, in the clinical situation, the occlusum will be checked.